Hi, I'm Russ Hornstein. This is the first in a series of videos I'm going to shoot just about my understandings of joint function, and I'm going to gear this towards health professionals, so this isn't going to be too high. So if you're a neurologist or some other higher level specialist, this might be a little bit basic for you, but I think some of the concepts will apply really to anyone. If you don't know anything about health, I hope you can still get something out of this, but I do have to use some technical language because there's a lot of complex subjects that I want to cover. So what I'm going to do is, this video specifically is about joint trauma and the effects of joint trauma on the body, and specifically on the joint and how the joint is stabilized, but also the effects, some of the effects on the nervous system. And in other videos we're going to go into more depth about what those effects are, how we can resolve joint traumas, how we can resolve joint function, if you will, and also what sort of effects we would expect as the joint function is resolved, and basically the ways in which we look at resolving joint function. So I may allude to a few of those concepts in this video, but primarily we're going to be looking at joint trauma, and in order to start on that, what we're going to do is look first at how joints are, how they function, how your muscles control joints. So the first thing is that, well, we're going to be talking primarily about cervical joints, so your neck joints. Your neck joints have layers of muscles around them. We're going to break those muscle groups down into intrinsic muscles, which we also refer to as stabilizing muscles. Those muscles are activated by a part of your nervous system in your brainstem, which is going to activate reflexively based on head motion, neck motion, and visual cues. And that's basically your vestibular system and your vestibular nuclei. Your vestibular nuclei are going to activate through the vestibulospinal pathway these intrinsic muscles, which again are going to activate very, very deep muscles reflexively in your neck, which are going to create stability. And basically when those muscles activate, they're going to be approximating the joint surfaces and creating the stability in the joint. So when we think about things like spinal curves, we see that when these intrinsic muscles are engaged and activated, that we have generally good spinal curves. Okay, so this is really important that these deeper muscles work. Again, they work in a reflexive way, but there are things that we can do to activate those reflexive systems. We also have another layers of muscles we call extrinsic muscles. Those are under voluntary control, and those muscles are muscles that attach to the joint and then basically anchor somewhere further away from the joint. So when they contract, what they're doing is actually moving that particular bone or a series of bones to affect some head motion or shoulder motion. So we're going to be referring to intrinsics, which are stabilizers, and extrinsics, which are prime movers. Extrinsics are under voluntary control and intrinsics involuntary or reflexive rather. So one of the issues that people have very often is that the joint is not moving properly. Now, whenever we're thinking about joint function, we have to remember that there isn't some sort of pin in the middle in which it rotates around. The way that the joint maintains its centration, or the central axis of rotation, is highly dependent on the tension of the musculature around the joint, both the intrinsic and the extrinsic muscles. So if we have an imbalance of extrinsic muscles or an imbalance of intrinsic muscles, that would create a very strange or a compromised joint motion. So for instance, if the muscles on one side of a joint are tighter than the other side, what will happen is that axis of rotation will shift towards the tension. So rather than rotating around a central axis of rotation, where we can have lateral flexion, flexion extension, and rotation around a central axis, whenever there's a tension, it's going to shift that axis of rotation towards that tension. So that's one way in which the joint function is going to be compromised by an imbalance of muscles. So first we're going to look at the imbalance of intrinsic muscles. So in other words, these again are the deep muscles that are stabilizing the joint. If we have an imbalance where the deep muscles are contracting on one side, what will happen is there is actually an inhibition of the opposite side muscles. So what will happen is if one side is contracting more, it will inhibit the other side of the intrinsics. So not only will it shift that axis of rotation, but some other motions which are specifically applying to that angle of the muscle in relation to the joint motion are going to affect a motion where there's going to be a restriction of motion where you're stretching the tight muscle, and an increase of motion where you're stretching the inhibited muscle. So this creates several problems, one of which obviously your joint can't achieve move towards its actual center or neutral position if that muscle is tight. Okay, so if the muscle on one side is tight, it's going to shift away from the neutral or central position and make it more difficult to return to a neutral position. In the same light, the inhibited muscle is not going to provide enough resistance to motion, so it will fail in stabilization in the vector of motion, which is stretching those inhibited muscles. So this obviously is a problem. One of the things that the body will do to try to compromise is your body doesn't want primarily for the joint to move beyond its normal range of motion. So that lack of stability is really the primary concern of the body, because anything which could compromise the integrity of your neck could obviously compromise the whole of your nervous system. So you don't want your head to be put into some awkward position where it's not stable. So what the body will do is it will recruit muscles, which are the extrinsic muscles, or muscles further away from the center of the joint, to try to limit that motion. Now bear in mind, as I said before, the extrinsic muscles are designed to move your joint away from the neutral position. So it's actually going to be pulling the joint not back towards the neutral position or towards the central position, but actually shifting the whole joint in a different vector, because it might be trying to pull it to the side. So in effect what it's going to do is again change and compromise that function of the joint. So you're still not going to achieve normal function, you're still not going to be able to achieve that central or neutral point of function when you have this compromise, but at least you will have, as a compromise, some sense of stability. Some of the issues in that are that the extrinsic muscles don't function or don't have the same metabolic capacity as the intrinsic muscles. Now, intrinsic muscles could contract all day long without a problem. They're very, very good at maintaining a consistent level of activation. The extrinsic muscles are meant to be switched on and off and are part of locomotion and our general activities of daily living. So if you have something which is compromising your ability to control and temper the amount of contraction and relaxation of the extrinsic muscles, then it's going to have some effect on activities of daily living as well. So namely what that means is, if you have some muscles which are tight, trying to, as a compromise to a lack of stability because of this issue in the joint, then what you're going to find is that you can't move your head as fully as you would. Okay, so one of the things that people would typically do is if they see a muscle that's tight, they might try to massage that muscle. Well, what you'd be doing is removing that compensation and then leaving the person with an unstable joint. And then probably the next day or the day after they'll be tight again, because your body actually needs that. So it's not a perfect compromise, but it's one that typically happens. So now that begs the question, how does this sort of situation actually occur? How would we end up with an imbalance of intrinsic muscles? So we have different types of sensors in muscles and joints and in all over our body. There's different types of sensors. But particularly in the joints, we're going to be referring again to muscles. We can go into more depth in later videos. But in the muscles, we have two different types of stretch receptors. We have the muscle spindle, which is a motion sensor. It senses the rate of change of length of the muscle. So it's how quickly your muscle is changing its length is sensed by the muscle spindle. And then you also have a load sensor, which is actually sensing the tension on the muscle, the forces going through that muscle. So the Golgi tendon organ is more of a position sensor. So the Golgi tendon is the load sensor, and the muscle spindle, it senses a rate of change. What often happens when we have some sort of a compromise in the joint is that you have a high force, so in other words a high amplitude of force and a high velocity of force. So A typical example of this is like a whiplash. When we have a very fast deceleration, for instance, like would happen in a whiplash, someone's driving their car and their car stops very suddenly, they run into something. What's going to happen is their head is going to want to carry forward, they're being held back by the seatbelt, and they're going to have a very high rate of change. And that stretch on the head, as the head goes forward, is going to create a stretch of the muscles which are supporting the back of the spine. That rate of change is beyond the threshold of perception of the muscle spindle. In other words, it has a minimum and a maximum rate of change that it can sense. So what ends up happening is all of that load goes into the Golgi tendon organ. So a very, very, very fast stretch will exceed the capacity of the muscle spindle to perceive that rate of change, and the sensation of that stretch will be sensed mainly by the Golgi tendon organ. So a high velocity stretch will be affecting or stimulating, creating a bias of activation of Golgi tendon over muscle spindle. So this is a very, very important concept that comes into play in the later videos we're going to talk about. But because there's a high amplitude of motion in the neck as well, your body doesn't have the ability to resist that, because a Golgi tendon organ isn't going to make the muscle contract and by inverse is going to make it relax. It's going to, we call, reset the gain of that muscle to a lesser tone. So a very, very high velocity of force or a very, very high speed stretch of the muscle will create a bias of activation towards the Golgi tendon organ, which will decrease the tone of that muscle. So following a high velocity stretch, we will see that we will have a decrease of tone of a muscle. Now, if that vector of motion, depending on how the whiplash happened, was on one side or the other side or both sides or straight ahead, it will affect different muscles around the joints. So say, for instance, it were to happen to one side, that rate of change is so great, the muscle spindle can't sense it. When the muscle spindle is sensing that rate of change, it will respond by making a muscle contract. This is the way deep tendon reflex works. But if that rate of change is too high, in other words, a very, very high velocity stretch, it will exceed that rate, you'll exceed that maximum threshold, and that rate of change will be sensed in the load sensor, the Golgi tendon. So that stretch is going to activate the Golgi tendon, and the Golgi tendon will reset the gain of that muscle. Instead of being at one length, it will reset it to a new length. So the effect is actually on the muscle that's inhibited. We see, when we examine someone, we see the muscle that's inhibited, or where that instability is. That's the one that was usually affected in the trauma. So what you're left with is a muscle being inhibited, and you'll have an instability within that vector. Very often, right after an accident, someone doesn't feel any different, because that decrease of tone you don't really notice. If they were to put their head all the way in one position, they might. However, it's not till a day or two afterwards that your body realizes that there's this instability and it has to compromise by building the tension of the extrinsics, and then the person will find themselves with limited motion. So this is a very, very key element in a joint trauma. What you're left with is a joint which is unstable, which will end up having other compromised muscle tensions around it, and there'll be a resultant decrease in the ability to return back to a neutral and fully stable position. Okay. Some people, chiropractors, have called this typically a subluxation. Subluxation means it's something less than actually coming apart, which is quite an extreme word for it. A newer word is joint position error, which is what it is. You don't have that sense of where that joint is. And I'm going to talk about that in the next video, about what a joint position error is and what effect it has on the brain. But for now, I just want to give a brief understanding of what it is that happens in a trauma. The main effect is that high velocity stretch, combined with the high amplitude, is going to force the joint into a very, very fast motion, which is going to create a bias of activation towards the Golgi tendon organ, which would decrease the tone of the stabilizing muscles, really all of the muscles in that vector, but particularly affecting the intrinsic muscles, which means you're going to lose stability in that vector of the trauma. So again, there'll be compromises and so on, but this is a long-term consequence. Now, there's also a difference between a high velocity, high amplitude, as we would see in a trauma, or high velocity, low amplitude, which is something that we use in chiropractic, which is a very, very fast stretch, but through a small amplitude of motion. And what I'm going to do is challenge a little bit about how those things are being done, because I think there's probably some room for improvement in how we're using this tool of a high velocity stretch to decrease the tension of muscles to actually create more stability of the joint. I think the way that things have been done for the last 120 years is probably somewhat flawed, and I hope in these videos to gain some critique on that, but I think I can substantiate quite effectively why that might be the case. Thanks for watching, and please tune into the next videos.